In order to reach universal health coverage, it's not only the concern of the Ministry of Health. Lots of other ministries need to be concerned, and political level at the highest level needs to be involved. We have with us from Iran, Dr. Akbar Haghdoost, who is the Deputy Minister for Strategic Planning and Coordination. Welcome.
Thank you very much.
Iran has for long had a very good primary healthcare system. You've done a lot of work with immunization, with HIV/AIDS control, with a lot of things. Now when we are talking about universal health coverage, what is the percentage of the population in Iran that have health insurance? Approximately what percentage?
Okay. Thank you very much for inviting me to this interview. In recent 4 decades, in the last 4 decades, we had 2 revolutions in the health system. First one was about the PHC, and the second one, which we called it Health Transformation Plan, started 5 years ago. And during these 5 years, we increased the coverage of insurance system, public insurance system, up to 93, 94%.
Up to 93%?
Yes.
All over, not only in the big cities?
No,
even
everywhere.
Okay.
In fact, the coverage in the rural area is much better than cities, and most of the costs in the villages and rural areas is free of charge. It's completely on the shoulder of the government.
But there is also private practice.
Yes, but in small cities and also villages, it's almost all public practice.
Okay. And you have another challenge, is that you have mountainous regions. I remember Mazandran going up those mountains. So how do you reach the people in very different?
2 packages inside the transformation plan is about the access in remote areas, and by some incentives which we put into place, the coverage in remote areas is much better because of the incentives which health staff, particularly GPs, will receive if they work in the remote areas.
Dr. Haghdoost, to reach this, to be able to have coverage for everybody, costs a lot of money. Where are the costs coming from? I mean, how does the government of Iran manage this? Through health insurance scheme that everybody puts money into? How much does the government put? How do you go about it?
In fact, the Rouhani, the president, in the first round of his election, mentioned health is the top priority in internal policy, and he spent a lot of his time and money on health. Now, in the first year of implementation, $3 more billion were released for the health system, and we try to use some routes for stable and persistent money to come to the health services. Now I think more or less the money is stable, and we have some idea annually how much we'll receive out of the normal budget of health in Iran.
I have another question. We are here in Salalah in Oman attending this very high-level meeting, ministers of health from all over. What do you think, do meetings like this benefit each other? I mean, what is the learning experience from being in a place like this?
Without any doubt, sharing experiences and learning from other countries and also sharing our experience with others is very important. And also motivation which we receive in such meetings, and also encouraging other organizations is very important. Now organizations from World Bank and UNICEF and the other,
here with us,
they are with us, and we will get this message and pass to our country, and we'll try to contribute, seek the contribution of other organizations, as you mentioned at the beginning of this speech.
So from the bottom of your heart, you feel Iran is on its way with 93% coverage. It's a question of improving quality all over, but you're on your way.
Inshallah, yes.
Inshallah.
Thank you very much.